Why Donald Trump is canceling health insurance for millions of people. In the United States, many people get health insurance through government programs like Medicaid and Obamacare, also called the Affordable Care Act. These programs help people who don't have a lot of money, including children, older adults, people with disabilities, and working families. But now, former President Donald Trump and many Republican leaders in Congress want to make big changes to these programs. These changes could cause millions of Americans to lose their health insurance. Let's break down what's happening, what changes are being made, who will be affected, and why this is all happening. What is happening? Donald Trump and Republicans are trying to pass a new law that would cut government spending on health care. They say they want to save money, reduce fraud, and make sure only the right people get help. To do this, they want to change the rules for who can get Medicaid and how people use Obamacare. Health experts, however, warn that this new law will make it much harder for many people to stay insured. About 17 million people could lose their health insurance over the next few years if this law passes. These people would no longer be able to afford doctor visits, medicine, or hospital care. This could lead to more sickness, more hospital emergencies, and even early deaths from treatable diseases. What are the changes? Here are the three biggest changes Trump's plan would make. 1. Cutting Medicaid. Medicaid is a government program that gives free or low-cost healthcare to people who earn low incomes, including children, seniors, and people with disabilities. Trump's plan would make several cuts and rule changes. Work requirements. Adults under age 65 who don't have a disability would have to work at least 80 hours every month. If they don't, they will lose their health insurance, even if they're caring for children, sick, or can't find a job. More paperwork. People would have to prove their income every 6 months instead of once a year. If someone forgets or makes a small mistake, they might be kicked out of the program, even if they still qualify. Less funding. Trump's law would give less money to the Medicaid program, which means fewer people could get help and services might be cut. These rules would be hard for many people to follow, especially those with unstable jobs, mental health problems, or low literacy levels. Even people who are working might lose their insurance if they forget to fill out a form on time. 2. Changing Obamacare. Affordable Care Act. The Affordable Care Act, also called Obamacare, helps people buy private health insurance through the government. It gives financial help, called subsidies, to lower the cost of monthly payments and doctor visits. Trump's plan would reduce or remove those subsidies, so people would have to pay more for insurance. Shorten the time people have to sign up for insurance every year. This makes it easier to miss the deadline. Make it harder for immigrants, even legal ones, to use these programs. All of this means that fewer people will be able to afford or sign up for insurance. Many will go without coverage and risk getting sick without any help to pay for treatment. 3. Blocking immigrants from getting help. Trump's plan also makes it harder for immigrants, even those who are legally living in the US, to get healthcare help. It would block undocumented immigrants and even legal immigrants from using Medicaid or getting subsidies through Obamacare. Many immigrant families with US-born children depend on these programs, so this could affect entire households. This will hurt many communities, especially in cities and border states where a lot of immigrants live and work. Who will be affected? The people most affected by Trump's plan would include poor families who rely on Medicaid to take their kids to the doctor, older adults who need help paying for medicine, people with disabilities who need regular health care, immigrants, even legal ones, who work hard but can't afford private insurance, people in rural areas, where doctors and hospitals are already hard to find, children, who may be dropped from programs if their parents lose coverage. Healthcare experts say 17 million people could lose their insurance. That's like the entire population of New York City and Los Angeles combined. Why is Trump doing this? Trump and his supporters say they are doing this to save money and reduce government spending. They also say that people should work to get benefits, and that some people are abusing the system. But many health experts, doctors, and advocacy groups disagree. They say that most people on Medicaid already work or can't work because of illness or caregiving. Making people fill out more paperwork causes them to lose coverage even when they still qualify. Taking away insurance makes people sicker, causes more emergency room visits, and leads to more debt for families. Some believe Trump is also doing this to pay for tax cuts and increase money for border programs. By cutting Medicaid and Obamacare, the government would have more money to spend on other things. Why does this matter? Health insurance helps people see a doctor when they are sick, get medicine and vaccines. Go to the hospital if something serious happens, get help managing long-term illnesses like diabetes or asthma. Without insurance, people may avoid going to the doctor until it's an emergency, not be able to afford medicine, go into debt from medical bills, die from treatable conditions. This means Trump's plan won't just save money, it could hurt real people. Families may lose their homes trying to pay for care, children may go without checkups or glasses, seniors may skip medicine they need to stay alive. Final thoughts. Donald Trump's new healthcare plan is not just about paperwork or politics, it's about real lives. Cutting Medicaid, changing Obamacare, and blocking immigrants from care will take away health insurance from millions of people. While supporters say the plan will save money and reduce abuse, experts say it will create suffering, sickness, and even early deaths. Healthcare is something that affects everyone, rich or poor, young or old. When millions lose coverage, we all feel the impact. Hospitals get crowded, medical costs go up, and our communities suffer. If you or someone you know may lose insurance, it's important to stay informed, check your eligibility, and speak up. Everyone deserves the chance to be healthy, and no one should have to choose between food, rent, or a visit to the doctor.